Thank you. I can't. You're infected. No, I'm only kidding.
My lady does not want to kiss me because of the Wuhan disease. It's okay, I understand. I'm Chinese. Okay. Get away from me.
An hour ago, they just announced they shut down all transportation to and from Wuhan.
But I said
It's changing every half hour, an hour.
Yeah, they are not from Wuhan.
Yeah.
Copy receipt.
Yes, please. Yeah.
Okay.
Don't even go back. Seriously. Not even anywhere over there. Don't go back.
He says, in this restaurant, they all live in America. In this restaurant, no
Yeah,
one...
but they have relatives. Hello. And it's Chinese New Year. That's ridiculous to say that. That's ridiculous. He shops in Chinatown. He goes to that market. Guaranteed. You're acting like you can only get this if you go there. You can get this from anyone who's visited.
I should ask this couple.
They don't know yet. In America, people don't know. This is changing by the hour. Everybody's working right now.
Mm-hmm.
Everybody's working. They're not going to find out till the evening news tonight when they hear it.
Oh, wow.
They'll get updated on the impeachment and they'll get updated on this. Either today at like the 5 o'clock news
can you say,
or the 11 o'clock news.
Can you say again what they blocked the transportation of Wuhan?
They've shut down, according to CNN.
Yeah.
They just shut down all the transportation in Wuhan. All of it.
No one can go
transit.
in. No one can come out.
Yeah, it's public transit. Everything's been completely shut down. And a couple of hours ago, the Chinese government had announced that they weren't going to. They were just going to suggest to the residents of Wuhan that they not travel. We don't want to scare people, is what they said. And then about an hour later, I got a message with a link from my son who's at school, and he's very up on these things, from CNN. And it said that it had been shut down. Transportation was shut down.
But the Chinese government have to warn their people to have a good New Year.
Yeah, so
they should have a peaceful, enjoyable, happy New Year.
So they can go home, be happy for that, because they're going to have a lot of people to bury and be very sad after that.
The stability of China is very important.
Sounds like 20% of their family is probably going to...
I mean that's very quiet then.
Okay.
There's stability.
Listen, they need to look at science. The science of this is, so far, what they're comparing this infection versus death rate. They are saying this is like the Spanish flu of 1918. Look that up. Look up how many people died, the percentage of people infected, and the percentage of people who died.
It's about 10%.
That's a lot.
50 million.
50 million people died.
In Europe.
Yep.
We call the Svartdøden in Norwegian. Svartdøden.
So how
to
so
translate?
They're saying that it was like 400 people who were infected and 17 people died that they know of, that they're willing to report. That's a very high percentage of people died.
Yeah. What is the translation for Svartdøden in English? It's a black death.
Oh,
black
yeah,
death.
yeah.
Okay?
Yeah.
Svartdøden.
So let's get...
yeah, okay.
Norwegian guy.
Yes.
And anyone who's taking this lightly, I don't see how it hurts to be cautious. How does it hurt to be cautious?
I talked to the lady and she said it's okay, it's just the flu.
It's just a flu.
Yeah, and America has a flu
people are dying
too.
From. Yeah, we don't have this kind of flu. It's our flu, the regular influenza, 0.1% of people die from it. 0.1. There were comparisons today because they're trying to give... I can show you the chart. It's on my computer. It was a news article.
10%.
0.1%. 0.1.
Yeah, but China is 10%.
Of this?
Yeah.
Whatever the
It is called circle something.
Listen. It's a certain type, because that's the part that's like the shape of it molecularly. Okay, that's why it's called that. There are so was SARS was the same type of, but this is a new one, so that's why they're calling it Wuhan, because that's where they found it. Anyway, what is happening is that it's a very say 400 people have it. I'm not sure the exact percentage, but I think it's Okay, out of 400, I think it's like 20 or 30%, maybe even up to 50% would get so bad that they need to be on oxygen. Okay? So how many people can fit in one hospital and be on oxygen? The percentage of people who die is going to be even higher because the hospital is going to run out of room and out of oxygen. And if the transportation's cut off, you're looking at Wuhan is going to die because they're just going to isolate them and say, you know what, we'll sacrifice them.
But after Chinese New Year, it's not only Wuhan.
I know. How many oxygen tanks do you have? How many doctors do you have? The doctors, 14 doctors got sick after contact with one patient.
Person, yes.
How many of the doctors are going to live through this?
You know, during SARS,
Yeah, SARS.
16 years ago,
Yeah.
when WHO went to Beijing to do investigation,
Yeah.
they take all the patients out, put in their hotel. So no patient. And another hospital, they don't have the facility. They put all the patients in the ambulance. And also the nurses together with these patients in the ambulance and driving up. It's like a city tour. Driving in the city
In a situation
until the investigation people gone, they bring them back to the hospital.
I believe it. But in a situation like this, I'm not a scientist, but what does this situation tell you? What's the only solution right now is containment. It's to stop the spread. That's the only way.
To tell the truth.
To tell the truth and stop the spread. Okay, I don't care about your stupid face. I don't care about saving face or commerce.
Stability is
If
important.
you don't have people alive to sell to, your commerce is dead anyway. You won't have any workers because they're all dead. Or their family's dead. Or whatever. How many people are going to be impacted even if they don't die? Everyone's going to be impacted by somebody they know died. Think about it that way. Is it going to be your mother or your father or your brother or your sister or your child? Everybody in China will be affected by this because they will know somebody. That's just how it goes.
Anyway, we have enough people. Don't worry. We have so many we can afford.
Is that how China looks at it?
I think the government looks like that. I don't know.
Is that how the Chinese people look at it?
I value every single life, okay? I love my motherland and my fellow citizens, fellow people. I love them. I value every single life. But through the history, it appears like this. They don't care for individual lives.
I mean, my neighbor who I barely know, the ambulance came and stopped out front. She's like not even 50 years old at the holidays because she's really stressed out. And her husband was there. Her daughter is the same age as, my kids. And I was worried for her. And she didn't even go off with them in the ambulance. She wouldn't go. She was like, oh, I'm fine, But her husband called because she's having heart issues. And I don't even know her except to say hi when she walks by. But still, so imagine your neighbor is like dying from this. And then their whole family gets infected. And you can't even go near them because you're going to get it. You can't even help them. They're out of food. What are you going to do? Throw them food?
Have just to. Otherwise,
what's going to happen? The transportation shut down.
You cannot pass
the transportation. If the transportation is shut down in Wuhan,
helicopter.
Are they going to bother? Or are they just going to say, "Oh, they're a lost cause," and let the whole city die?
The city will not die.
Some people will survive, of course. It's not 100% death rate, but it's still pretty damn high.
Now the real worry is how badly it's going to spread.
Exactly.
I'm really look at after the New Year, after we call it another Nighton Festival. Nighton Festival, yes. It's about like 1 week.
Lantern Festival.
Festival.
Yeah.
After about 1 week after 1 week or 10 days something.
Yeah, they're saying
15
7.
days.
It's
Yeah.
like 7 to 10 days for it to show.
Yeah. So I really look at around from 5th to 10th of February. The picture will be very, very different. Now it's really like a day by day, hour by hour differences.
Yeah, it is.
But from 5 to 10 will be very crucial to see how badly spread.
Yeah.
Yes. So this is what I'm really worried about. Is that it's not only one city. How badly it's going to spread all over the world, all over China and all over the world.
I know, of course.
Yeah.
But actually, what will happen before then is like Wuhan shut down, and then the WHO's out there, and you know what? I don't think they're going to take. I don't think America and like UK is freaking out already. Canada, I don't think they're going to take the chance to let it just keep going. They've already started doing health checks. I think since it keeps changing hour by hour, the same thing's going to happen here with the policy, and it's not going to just be flights from Wuhan. It's going to be flights from everywhere in China and Asia.
The thing is that if they stop the traffic of Wuhan, will cause national panic.
But it's the way it has to be.
Panic, because
do you want national panic or national death? Which?
Because Wuhan is the central of China, and it is a transit hub.
No, I'll show you.
Of China. Everyone from north to south, east to west,
can you see
vice
this?
versa, have to go through
Can you
Wuhan.
see this?
Yes.
An hour and a half ago now. And 2 new updates. Hold on. In an hour and a half. Wuhan, coronavirus outbreak kills 17 in China as first case found in U.S. Okay, so far we know at least 17 people are dead in China and more than 500 infected as the Wuhan coronavirus continues to spread throughout Asia and across the world. Human-to-human transmission confirmed. Wuhan announces transportation lockdown. Public transportation will be suspended in Wuhan. Wuhan, you say? Is it
Wuhan?
Wuhan. Starting tomorrow, according to an announcement from the city's coronavirus command center. They actually have a command center just for this. All city transportation will halt, including local buses, ferries, long-distance buses, and subways. Wuhan's airport and railway stations will be temporarily closed, they put in quotes, for departing passengers. No departures.
No departures.
From Wuhan.
Okay, if you have your air ticket in your handy, and if you are at the airport, you cannot depart.
When these services will reopen remains to be determined. Don't know.
Further notice.
The command center also advises residents not to leave Wuhan unless they have a special reason. The measures aim to keep the virus from spreading and to ensure public safety and health, according to the announcement. They take effect at 10 a.m. local time Thursday.
Wow, it's a panic now. Everyone is trying to get out. The highway, the freeway, you know, even people walk.
Yep.
We walk on the railway. They want to get out of Wuhan. This is you know. Have you seen the movie called Cassandra Bridge? Cassandra Bridge is a movie that they find a virus in the train, so they seal the train and want the train to die.
Yeah.
And how a doctor and work together with some people and survive.
There have been a lot of movies with this same scenario.
Yeah.
Lots of them.
So they seal the city and let the city die.
Yep.
Wow.
All right, let's get going.
I'd like you to read what a fortune.
This is your fortune.
Yeah.
Mine didn't have a fortune in it.
Yes.
Mine was empty.
Right.
This is what his says. Everything's going to be okay. And the back says, no one reads your blog, but everything's going to be okay.
Okay, please read my blog. Please watch my blog. Okay.
You have a blog.
Yeah, blog.
Blog.
Yes. Everyone watch my videos on my YouTube. Okay. I give a lot of message. Okay, let's go to PayPal.